Please go ahead.
So I think that with any further ado, that if I can introduce myself, I'm Dr. Mostert. I'm a GP here in Fort Nelson. I've been here, I think, about 30 years approximately. And we are presenting this to you to become part of the rural and remote division of family practice. We feel that there's a good fit there, and we hope that you guys are going to see the same fit as what we see there. I recognize that we are on the traditional lands of the Treaty 8 First Nations here in Fort Nelson. So if I can do the presentation that we've got, if I can get the next slide. The Northern Rockies Regional Municipality has a well-established group of physicians serving the municipality, which includes Fort Nelson, Toad River, Prophet River, and Fort Nelson First Nation. In addition, there's a fairly large portion of patient care provided to travelers and workers in the region. The Physicians Medical Clinic, Fort Nelson General Hospital, Public Health Unit, and Emergency Services are all located in Fort Nelson, which is located at mile 300 of the Alaska Highway at the confluence of the Sikanee, Muskwa, and Prophet Rivers in the northeastern part of BC. The Fort Nelson and Prophet River First Nations all have community health centers in this region, and we have a fairly close cooperation with them. If I can get the next slide, please. Leanne. There is a health care steering committee which participates by the Chief of Staff, Northern Health COO, and HSA, as well as local First Nation health representatives and emergency services, public health, and municipal councillors. I normally go to that meeting as well to represent the physicians here in the town. We meet approximately once a month. Community health plan was developed by the steering committee with input from over 500 community members. The Fort Nelson General Hospital has acute care beds of 15 with 7 residential beds. Nearest major medical center is Prince George, about 820 kilometers. The nearest town or city to us is Fort St. John, which is about 400 kilometers, and there is virtually nothing in between. So it's 400 kilometers of open road. We do have issues with transportation and emergency evacuation out of Fort Nelson, but I think that is, in a lot of other centers, it is very similar. Next slide, please. We began this journey of becoming a division in approximately 1999. In August of 2020, we began with a growth and sustainability phase. Since August, there's agreed structure in place. A coordinator has been hired, and a vision, mission, and strategic priorities have been developed. Engagement has been started with northern divisions of family practice by attending regular interdivisional meetings to share learnings and discuss issues of importance across the region. The next steps for us is, after meeting with rural and remote, we hope that we're going to join with rural remote, and then with joining the division at that stage. Next slide, please. So I'm the physician lead. We have 5 permanent physicians in town. Dr. Fourie is a locum from South Africa that frequently comes here for approximately 3 months. With COVID, we've had trouble getting him here because of visa issues. He's fully registered with the College of Physicians and Surgeons, so it makes it relatively easy for us to get him to work here, but we've got to jump through the loops of getting him the work visa when he comes up here. Diana Penny is the contracted support since September 2020, and our engagement partner with Doctors of BC is Monique. Next slide. Our vision is to be locally relevant, innovative, accessible, and sustainable health services for the Northern Rockies health region and communities. Our values is to be accessible, to have quality healthcare, caring, connected, and innovation. Next one. So the strategic priority number one that we had is supporting physician healthcare improvement in community and facilities. We've started developing community resources and communication plans, improved the emergency response and transfer for local areas, and identify opportunities for improved healthcare in our First Nation communities. Next one. Strategic priority 2 was support relevant physician development and capacity building. We've identified developing opportunities to support the expanding range and impact of services. And we've also development of physician leadership and capacity locally. Next. Strategic priority 3 was supporting meaningful collaboration with strategic partnerships that influence improved access to and sustainability of rural relevant primary care in our community. We've had enhancing relationship between the family physicians and the hospital administrators, health authorities, specialists, and other stakeholders, improved support for patients' mental health, well-being, and substance use problems, and increasing visiting health services and telehealth to provide services and locally and reduce travel. Next. The highlights so far that we've had in the time period that we've been with the growth and sustainability is to set up a community communications via various medias. We've got a clinic Facebook page and physician and clinic listings and pathways. Once part of the vision to create pathway communication pages as well. We have been partnered with UBC to pilot a group of virtual focus training with all the physicians. I think our group was the first in Canada to actually do it, and it went very well and everybody enjoyed it. We still ongoing daily use of ultrasound from both the facility as well as in the clinics. We've had a setup of an iPad with access to real-time virtual supports at the hospital and on physician phones, attending Northern interdivisional meetings and Fort Nelson Health Plan Steering Committee. Physicians have been offering CBT and group medical visits to provide local services. ACLS, BLS, and PALS training was done even during COVID. We are starting with safer care with electronic healthcare to go live in 2020. In progress is also setting up a Care Connect in the clinic, and in progress is 2 additional technology-enabled platforms to improve patient care.